Will the House please come to order and members kindly take your seats? Welcome back. Good afternoon. The bill order for this afternoon, we have 5 bills we will be taking up. They are S-298, S-328, S-197, S-578, and then finally H-727. Again, S-298, S-328, S-197, S-578, and then H-727. So with that, we'll start with Senate Bill 298, which is an act relating to creating the Vermont Voting Rights Act. The Senate concurred in the House proposal of amendment with further proposal of amendment thereto that is printed in today's calendar. Member from Charlotte.
Madam Speaker, your House Government Operations and Military Affairs Committee recommends that the House concur with the Senate proposal of amendment to the House proposal of amendment to S-298, an act relating to the Vermont Voting Rights Act. In the first instance of amendment from the Senate, we had made a recommendation that when directing the State Ethics Commission to respond to inquiries about ethics issues, we had specified that they should do so by email or phone. And that presented a challenge for the Ethics Commission. And after some testimony in the Senate, removed that phrase email or telephone that we had added, but it doesn't prevent them from responding by email or phone. So it leaves it open as to how they should respond. The reason that we wanted to do that in the first place was to make sure that we had access for people who maybe didn't have broadband or had a disability. And we believe that remains, that our intent that be so remains in the bill. In the second instance of amendment for them, there has been some back and forth, a lot of back and forth about what should happen with the candidate financial disclosure form. And there was a disagreement about whether the Secretary of State's office should sort of create it and house it and answer questions about it, or the Ethics Commission. And when my children were little and they would come to me with a problem, I would say, you can work it out, go work it out. And then they started coming to me and preemptively saying, we don't want to work it out. Here's what the problem is. But we are asking them in this, the Senate is asking, and we concur that they should go work it out. So this section directs them on or before January 30th of next year that they have combined and shared recommendations on how they are going to resolve this issue. And they is the Ethics Commission and the Secretary of State's office. Hopefully they can come up with a compromise or something, a process that works for everybody. So we are asking them to do that and then report back to House GovOps and Senate GovOps. And then the final instance of amendment with which we also concur is last year we revised a law lowering the threshold that would trigger a person or an organization to become a PAC. We had changed the word or to an and to an or about accepting or contributions or making expenditures. That proved to be problematic for some organizations and unions. So we haven't completely gone back to the way it was before, but we did change the or back to an and most other things remain the same, and we did not add back in the thresholds that were previously there. The vote out of committee was a straw poll of 11-0-0 in favor of the Senate's proposal of amendment, and we recommend that the House do the same.
So the question is, shall the House concur in the Senate proposal of amendment to the House proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have concurred in the Senate proposal of amendment. Members, earlier today at 12:55 p.m., the clerk emailed to you all the committee reports on Senate Bill 328, which is an act relating to housing and common interest communities. Member from Poultney, can you please offer us a motion to suspend our rules to take up Senate Bill 328 for immediate consideration pending its entry on the notice calendar?
Madam Speaker, I make a motion to suspend rules in order to take up for immediate consideration S328 pending entry on the notice calendar.
Member from Poultney moves that we suspend our rules to take up Senate Bill 328 for immediate consideration pending its entry on the notice calendar. Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up Senate Bill 328 for immediate consideration. Senate Bill 328 is an act relating to housing and common interest communities. The bill was referred to the Committee on General and Housing, which recommends that the House propose to the Senate to amend the bill. The member from Chester, Representative Charlton, will speak for that committee. In affecting the revenue of the state, the bill was referred to the Committee on Ways and Means, which recommends that the report of the Committee on Ways and Means be amended. A member from Woodstock, Representative Kimball, will speak for that committee. And then carrying an appropriation, the bill was referred to the Committee on Appropriations, which recommends that the bill ought to pass in concurrence with the proposal of amendment recommended by the Committee on General and Housing, and then when further amended as recommended by the Committee on Ways and Means, and then when further amended as recommended by the Committee on Appropriations. The member from St. Albans Town, Representative Dickinson, will speak for that committee. Again, members, you will find these committee reports in the clerk's email sent to you at 12:55 today. Please listen to the second reading of the bill.
S328, an act relating to housing and common interest communities.
Member from Chester.
Madam Speaker, your Committee on General and Housing, to which S328 was referred, recommends the House propose to the Senate to strike all amendment, which I will shortly take us through. The House General and Housing Committee has worked closely with Senate Economic Development, Housing and General Affairs throughout the session. And as a result, there's a great deal of similarity between this and H775, which was reported to and passed by the House on March 18th. Links to the text, as noted, are in the email, which was sent from the clerk's office at 12:55, as are links to the amendments. This is essentially the omnibus housing bill for the session. It addresses a number of specific needs and opportunities to further abate our current housing crisis. Here we are, section by section. Section 1 regards common interest community resources. This requires the Secretary of State to provide general information resources, whether on their website or otherwise, for the public regarding Vermont's common interest communities. This is homeowners associations, condominium associations, manufactured home community co-ops, and others, for example. This includes the variety of governing statutes relative to each and is anticipated to help residents navigate the laws and regulations which have evolved separately in many instances and in a way that can be very confusing to the consumer. Section 2, the Service Supported Housing Advisory Council is created. This is to increase the alignment between human services and policies that serve individuals receiving Medicaid-funded developmental disability services and the housing capital and support services. And the composition of the council is defined in the bill. The council will have technical and legal assistance from the Department of Disabilities, Aging and Independent Living, and will advise the Vermont Housing Conservation Board on the production of permanently affordable housing for individuals eligible for Medicaid-funded developmental disability services. This is a specific and unique housing need that we've identified during the session. Section 3 is familiar from H755. It authorizes the state treasurer to expand the 10% for Vermont program to 12.5% of the state's average daily cash balance, consistent with the Uniform Prudent Investor Act. up to one of the 12.5% of the average daily balance may be used for a credit facility specific for housing development through the bulk purchasing of off-site constructed housing and to aid in the purchase of off-site construction housing units. Section 4, the off-site construction accelerator pilot is also familiar from H775, and the concept of aggregated bulk purchases of off-site constructed homes this will be further condensed and simplified in the Ways and Means Amendment, which will be shared momentarily. Communication from small developers, emerging small developers, smaller projects, rural communities indicate that any small increment that shortens delivery times and decreases costs is critical right this moment. Section 5 adds language to the definitions in 10 VSA 212, and this is to allow the Vermont Economic Development Authority to invest in multi-unit housing, which they were not able to do before. Sections 5A and 5B will be added in the much anticipated Ways and Means Amendment, reflecting the specific language of the arrangement between VEDA and Vermont Housing Finance. Section 6, VHIP, the Vermont Rental Housing Improvement Program, which has been now included in base funding in the budget, will be codified in this section. This is the existing program, which is very successful, and adds it to statute from session law. Section 7 was also in H775. These are special assessments to help finance project-related infrastructure, especially useful in rural areas where they might support group septic plans, access roads, other improvements for a housing project. The benefited property owners pay for the bond through annual assessments for a specified period of time. They are not general obligation bonds for which the municipality can be held liable if assessments are insufficient. Understandably, those require the vote of the town. These are revenue bonds solely repaid from the assessment of the properties that benefit and only require a vote of the governing body of the municipality. There are additional sections 7A and 7B with specifics that will be included in the Ways and Means Amendment. Section 8, under 24 VSA 4382, municipal plans are addressed. This adds to the housing element already required in a municipal plan to include an analysis of regulatory and physical constraints that are preventing the creation of housing and a description of actions that municipality may take to accommodate the projected housing needs. Section 9, required provisions and prohibited effects. This adds language on the equal treatment of housing and provisions for affordable housing already required of municipal plans. With exceptions in 24 VSA 4414, no bylaw shall have the effect of excluding mobile homes, modular housing, manufactured housing, or prefabricated housing from any district that allows year-round residential development except on the same terms and conditions as conventional housing would be excluded. There are 3 reports called for in S328. In Section 10, the Common Interest Community Report is required from Legislative Council. This is to outline the legal, conventional financing, and funding compliance issues related to requiring common interest communities to allow leasing of residential units, to authorize commercial activities within a dwelling unit, and the permitting of accessory dwelling units. Section 11, the Vermont Housing and Conservation Board Farm Worker Housing Report. This is a follow-up report to assess progress made toward meeting the goals identified in their Farm Worker Housing Needs Assessment of 2021, and to identify any barriers that have emerged, which are barriers to improving and expanding the program. Section 12 requires the Department of Housing Community Development to produce a report investigating corporate purchases of homes. The purpose of this report is to assess the activity of what I might colloquially call private equity investment in single and 2-family homes in Vermont. The language in the bill includes detail as to what is and what is not considered. This is reflective of reports that we have that Vermont, though right now, has a low incidence of private equity ownership in single and two-family residences, but it is growing faster here than anywhere else in the country. This report will help us position ourselves and get ahead of this to prevent the problems that it can cause. Section 13 regards fiscal year 2024 one-time appropriations. The amendment from Appropes will explain this. Their recommendation is to take this section out because it has been included in the budget. It's no longer needed here. Section 14, the effective date of July 1, 2026, is the only line that has not been revised since this whole process began. It's very special. S328 is amended, passed out of our committee on a vote of 10-1-0, and we ask for the body's support. We have heard from the reporter of the bill from Senate Economic Development, Housing and General Affairs, the sponsor of the bill, Executive Director of Vermont Housing Finance Agency, 3 members of Ledge Council, Office of Legislative Counsel, the President of the Vermont Bankers Association, General Counsel, Vermont Housing Financing Agency, the Director of Community Relations with Champlain Housing Trust, the House Committee on Agriculture, Food Resiliency, and Forestry, General Counsel and Director of Closing from the Vermont Economic Development Authority, the Commissioner of the Department of Housing and Community Development, Chief Executive Officer of Vermont Economic Development Authority, Deputy Secretary of State of the Secretary of State's Office, Executive Director of the Vermont State Labor Council for AFL-CIO, and member of the Jericho Housing Committee, the Director of Policy and Special Projects of the Vermont Housing and Conservation Board, the lobbyist for the Working Vermont, Executive Director of Vermont Developmental Disabilities Council, Chair in the Act 69 State Housing and Residential Services Planning Committee, the Municipal Policy and Advocacy Specialist of the Vermont League of Cities and Towns, and Advocacy and Public Policy Director of the Vermont Association of Realtors. Thank you.
And now speaking for the Committee on Ways and Means, member from Woodstock.
Thank you, Madam Speaker. S328 was referred to your Committee on Ways and Means because House General and Housing added many elements of H775 to the bill, which included 2 provisions that affect the revenues of the state. First, the increase in the credit facility for local investments from 10 to 12.5% of the state's average cash balance as managed by the state treasurer. That could potentially result in a loss of $600,000 in annual interest income that is going into the general fund. When we reviewed this provision under consideration for H775, we found that it was a worthy foregone revenue, and this body voted in favor of that previously in March. Second, the amended S328 includes the creation of special assessment bonds for municipalities, which could affect the revenues and financial condition of those municipalities. Again, when we considered H775 previously, we found that there was no fiscal impact because the assessments levied on the properties would not add to the general obligations of the municipality. You'll find more detailed information about the fiscal impact of the credit facility and the fiscal note for S328 that is posted to our committee page. However, Madam Speaker, that is not all. House Ways and Means is offering an amendment to S328, which was emailed and is also available on the desk in the center of the well of the House. The amendment has 3 instances of amendment, all brought to us by the Committee on Housing and General Affairs as friendly amendments that came about after receiving additional input from the administration and the State Treasurer's Office and the Vermont Housing Finance Agency. In the first instance, we propose to strike out Section 4 of the bill that is related to the Off-Site Construction Accelerated Pilot and replace it with a new Section 4 that is slightly different construct. In this new version, the State Treasurer's Office is tasked with developing the pilot demonstration project instead of a collaboration between the Agency of Commerce and Community Development and Building and General Services. It was the feedback from ACCD that they did not have the bandwidth to stand up the project, and the Treasurer's Office has said that it does, hence the shift. It relieves the project of the task to align state and local permitting and creating and adopting building codes for off-site construction, as that is not the expertise or purview of the State Treasurer's Office. This instance also does not require the identification of one or more municipalities to participate. Lastly, the time frame is shortened with the Treasurer's Office tasked with reporting back to the legislature in January of 2027. In the second instance, again by friendly amendment, two new sections, 5A and 5B, put into statute the Vermont Housing Finance Agency Rental Housing Revolving Loan Program, transferring it from session law in 2024 and 2025 into Title 10 of Vermont Statutes Annotated. The second instance changes just one aspect of the rental housing revolving loan program as it currently exists, and that is to change the income eligibility criteria that was originally approved. The program, intended to help smaller projects for new and existing developers of middle-income renters, originally restricted loans for construction of units for renters between 65 to 80% of area median income at $150,000 per unit constructed or renovated, and 81 to 150% of adjusted area median income at $100,000 per unit. This amendment changes the lower income threshold to, quote, up to 80%, end quote, which gives VHFA the flexibility they need to leverage low-income housing tax credits, which come with lower income eligibility requirements at 60% of adjusted area median income. VHFA will still be using this program to focus on small projects with new and emerging developers and focusing on middle-income housing. Moving this program into statute from session law makes the program more permanent. According to testimony, the revolving loan program has approximately $13 million in funds available for these important investments. The third and last instance of amendment add two more sections, 7A and 7B, which tie up some loose ends regarding the special assessment districts. That is, these sections provide clarity that the special assessments are not to be considered property taxes, that their purpose was to secure a special assessment bond as contemplated in the underlying bill. Madam Speaker, your Committee on Ways and Means voted 11-0-0 to amend the bill as presented. We heard from the Chair of the Housing Committee on General and Housing Affairs, the Legislative Counsel, the Office of Legislative Counsel, and the Senior Fiscal Analyst for the Joint Fiscal Office, and we ask for your support.
Member from Chester.
Madam Speaker, the House General and Housing Committee reviewed the amendment from Ways and Means and found it favorable, 803.
And now speaking for the Committee on Appropriations, member from St. Albans Town.
Thank you, Madam Speaker. The House Appropriations Committee reviewed S328. This is the act relating to housing and common interest communities. The Appropriations Committee added an amendment to Section 2 regarding the per diem compensation for the Service-Supported Housing Advisory Council. So the first instance of amendment is the language that was added says that the payment for the Advisory Council shall be made from the monies appropriated from the Department of Disabilities, Aging, and Independent Living in its base budget. The second instance of amendment is striking Section 13, which is already included in the 2027 budget in Section C107. So this does not require any extra appropriation. The committee heard from the Ledge Council, Joint Fiscal Office, and from the Chair of the General Housing Committee. We approved the amendment 11-0-0 and the bill, and we ask for your support.
Excuse me, member from Chester.
Madam Speaker, the House General and Housing Committee reviewed the amendment from the Appropriations Committee and found it favorable on a vote of 9-0-2.
The first question is, shall the report of the Committee on General and Housing be amended as recommended by the Committee on Ways and Means? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have amended the report of the Committee on General and Housing. Now the question is, shall the report of the Committee on General and Housing as amended be further amended as recommended by the Committee on Appropriations? Are you ready for that question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have further amended the report of the Committee on General and Housing. Now the question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on General and Housing as amended? Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have proposed to the Senate to amend the bill. Now the question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. Member from Poultney, can you please offer us a motion to suspend our rules to place Senate Bill 328 in all remaining stages of passage?
Madam Speaker, I make a motion to suspend rules in order to put S 328 in all remaining stages of passage.
The member from Poultney moves that we suspend our rules to place Senate Bill 328 in all remaining stages of passage. Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have placed Senate Bill 328 in all remaining stages of passage. Please listen to the third reading of the bill.
S 328, an act relating to housing and common interest communities.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have passed the bill in concurrence with proposal of amendment. Member from Poultney, can you please offer us a motion to suspend our rules to message our action on Senate Bill 328 to the Senate forthwith?
Madam Speaker, I make a motion to suspend rules in order to message our actions on S 328 to the Senate forthwith.
The member from Poultney moves that we suspend our rules to message our action on Senate Bill 328 to the Senate forthwith. Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended our rules to message our action on Senate Bill 328 to the Senate forthwith. Members, earlier today at 2:25 p.m., the clerk emailed to you all the committee reports on Senate Bill 197, which is an act relating to payment reform for primary care. Member from Poultney, can you please offer us a motion to suspend our rules to take up Senate Bill 197 for immediate consideration, pending its entry on the notice calendar?
Madam Speaker, I make a motion to suspend rules in order to take up for immediate consideration S 197, pending its entry on the notice calendar.
The member from Poultney moves that we suspend our rules to take up Senate Bill 197 for immediate consideration, pending its entry on the notice calendar. Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up Senate Bill 197 for immediate consideration. Senate Bill 197 is an act relating to payment reform for primary care. The bill was referred to the Committee on Health Care, which recommends that the House propose to the Senate to amend the bill. The member from Rockingham, Representative Goldman, will speak for the committee. Affecting the revenue of the state, the bill was referred to the Committee on Ways and Means, which recommends that the bill ought to pass in concurrence with the proposal of amendment recommended by the Committee on Health Care. The member from Norwich, Representative Holcomb, will speak for that committee. And then carrying an appropriation, the bill was referred to the Committee on Appropriations, which also recommends that the bill ought to pass in concurrence with the proposal of amendment recommended by the Committee on Healthcare. The member from Morristown, Representative Iacovone, will speak for that committee. Again, members, you can find these committee reports in the clerk's email sent to you at 2:25 today. Please listen to the second reading of the bill.
S-197, an act relating to payment reform for primary care.
Member from Rockingham.
Madam Speaker, S-197, an act relating to payment reform for primary care, was referred to the House Health Care Committee from the Senate, and I respectfully report that it has considered the same and recommends that the House propose this strike-all amendment to the Senate. The vote in your House Health Care Committee in support of this amendment was 10-0-1. You will find this bill on page 3181 of the May 18th House calendar or on the House Health Care Committee page. It is no secret that our healthcare system is in crisis. Skyrocketing premiums are making commercial insurance increasingly unaffordable for individuals, families, and employers. Lack of access to primary care pushes patients to urgent care and emergency departments, resulting in fragmented care and overall higher costs. Primary care clinicians spend an excessive amount of time on documentation and desk work, diverting time from patient care and reducing practice satisfaction. Reimbursement structures favors procedures and interventions over primary care. In 2020, only 10.2% of medical spending went to primary care. The primary care workforce shortage is increasing due to insufficient reimbursements, administrative burden, and high burnout rates. According to the Vermont Medical Society, Vermont will be short 370 clinicians by 2030. It is the intent of the General Assembly through S-197 to invest in primary care and establish a payment reform program of universal primary care that works for all Vermonters. Primary care is known to improve health outcomes, lower costs, and provide continuous care for patients throughout their lives. The Health Care Committee heard testimony that for every $1 spent in primary care, the healthcare system saves $13. What might a universal primary care payment reform look like? Payments in primary care practices would shift away from the fee-for-service model. In our current system, payment is made on a visit-by-visit basis and only reimburses for the visit with the clinician. In a universal primary care model, a practice would get monthly payments for each patient attributed to the practice. This income would be relied upon by the practice and used in ways that supports the needs of the patients in that practice. The Vermont Steering Committee for Primary Care, created by this legislature in 2025, has defined the characteristics of a high-functioning primary care system and believes primary care is at its best when it is team-based. What do I mean by team-based care? Maybe someone is coming in for a blood pressure check, and what becomes evident in the visit is the individual cannot afford their medication or that they're homeless. This is where the member of the team can step in to assist the patient. Members of the interdisciplinary team in a primary care practice may include a nutritionist, a pharmacist, a nurse case manager, who are individuals working at the top of their ability as determined by their training degrees. Team-based care leads to improved clinical outcomes, increased patient engagement with treatment and follow-up, as well as decreased admissions and utilization of the emergency department. We have been aware of the problems in our healthcare system for decades, and Vermont started addressing these concerns in 2006 by establishing the Vermont Blueprint for Health. A pilot site was initially created in St. Johnsbury, and there are now 124 participating practices. Most Blueprint initiatives are funded through per-member, per-month payments made by various payers and are supporting team-based care. The Healthcare Committee heard testimony from the administrators of the Blueprint for Health and learned there has not been a systemic systematic evaluation of the blueprint for a number of years, and that this evaluation, reassessment, and retooling is actively underway. In S-197, the Agency of Human Services and the blueprint are being asked whether the blueprint is the best mechanism for the implementation of a universal primary care system. From the patient's perspective, costs and access are challenging. According to the 2025 Vermont Household Health Insurance Survey done by the Vermont Department of Health, 3% of Vermonters are without health insurance. But it also found that 30% of Vermonters were uninsured. High insurance cost sharing, including deductibles and co-pays, lead patients to delay getting care, resulting in worse outcomes and increased costs. With the elimination of federal subsidies, many Vermonters find access to insurance simply out of financial reach. S-197 lays out a path to strengthen primary care and support development of a payment model that addresses Vermont's health care goals: to stay healthy when they're well, to return to health when they are sick, and to prevent their condition from deteriorating over time, and to do so in a way that creates access to primary health care that is affordable. I will now review the sections of the bill. Section 1 is the legislative intent. It is the intent of the General Assembly to invest in primary care and establish a program of universal primary care that is accessible and affordable for all Vermonters and will promote the public good by improving the patient experience of care, improving population health, reducing costs, improving the well-being of the healthcare workforce. The purposes of this bill are to develop a framework for implementation of universal primary care, optimize the Vermont Blueprint for Health, determine whether the blueprint is the appropriate mechanism through which to provide universal primary care, and explore other approaches to universal primary care payment models should the blueprint not be found to be the best mechanism. Section 2, 18 VSA, Chapter 13, Subchapter 1, Blueprint for Health, amends the subchapter on the Blueprint for Health to require health insurers to submit information to the Agency of Human Services, AHS, at least quarterly to allow for an analysis of the total cost of care in Vermont and implementation of payment models addressing healthcare capacity, volume, quality, and clinical outcomes. Requires per person per month payments to all primary care practices, not just medical homes, and requires health insurance to pay amounts at least equal to Medicaid starting in 2027. Section 3, Blueprint Payments to Practices, Primary Care Report. Requires the Director of the Blueprint for Health, in consultation with others, to report to the General Assembly by January 15, 2027, on changes to payment amounts or methodologies, or both, that would be needed to transition the Blueprint's payments to primary care practices to include payment for routine primary care needs of attributed patients, including defining primary care practices and primary care providers, and which services should be considered routine primary care, providing an operational plan and a proposed timeline for implementation, describing how the Blueprint can optimize delivery of the services in each of its current initiatives and the costs of doing so, recommending how to transition to using the health care claims tax to fund the Blueprint, and providing a potential timeline for implementation. Requires the Blueprint Director to be available to provide updates to the Health Reform Oversight Committee, or HROC, during the summer and fall of 2026. Section 4, Primary Care Spending, Agency of Human Services Report. Requires AHS, in consultation with the Green Mountain Care Board, GMCB, to report to the General Assembly by January 15, 2027, on the baseline per person per month spending on primary care services in Vermont overall and by payer. Section 5, Primary Care Spending Target Report, directs AHS to set a target for the amount of per person per month spending on Vermont residents that should be for primary care services, and to develop a schedule to increase the target over time. Requires AHS to provide the targets and schedule to the General Assembly by January 1st, 2028. Section 6, distribution of duties for the healthcare regulation and healthcare reform report. Directs AHS, GMCB, and the Department of Financial Regulations, DFR, to evaluate their roles, their organizations play in healthcare regulation and healthcare reform, and identify where each function should ideally be housed. Requires AHS, GMCB, and DFR each to provide their recommendations on their preferred distribution of responsibilities to the General Assembly by January 15th, 2027. Requires AHS, GMB, and DFR to be available to provide updates to HROC during the summer and fall of 2026. Section 7, transitioning care to community settings report. Requires AHS to report to the General Assembly by January 15th, 2027, with recommendations on ways to accelerate the appropriate transition of patients from hospital care to care delivered in community settings, and directs AHS to incorporate the recommendations into the healthcare delivery strategic plan as appropriate. Section 8, Regional Universal Primary Care Program. Directs the Office of the State Treasurer to explore with other Northeastern states the potential for establishing a regional universal primary care program and report to the General Assembly by January 15th, 2027. Section 9, 8 VSA, subsection 4092, prescription drug coverage. Requires a health insurance to give at least 60 days notice to all covered individuals who filled a prescription for a particular drug within that previous year if the insurer plans to eliminate insurance covered for that drug. Section 10, effective date. The act would take effect on passage. Witnesses include Executive Director, Vermont Medical Society, Deputy Commissioner of Insurance, Department of Financial Regulation, Executive Director, Green Mountain Care Board, Deputy Chief Counsel, Office of Legislative Counsel, Chief Operating Officer, Community Health Centers of the Rutland Region, Physician Assistant, Thomas Chittenden Health Center, Family Nurse Practitioner, True Path Wellness, Professor of Medicine and Health Policy, the Dartmouth Institute, Chief Healthcare Advocate, Vermont Legal Aid, Director of Legislative and Government Relations, Blue Cross Blue Shield of Vermont, Consultant, Agency of Human Services, Sponsor, Senate Committee on Health and Welfare, Medicaid and Health Systems Director, Agency of Human Services. Board Member, American Academy of Pediatrics, Vermont Chapter. Board Member, Vermont Healthcare for All. Program Director, UVM Family Medicine Residency Program. Primary Care Provider, Richmond Family Medicine. Government Affairs Director, Cigna Healthcare. Executive Director, Health First, Inc. Executive Director, Blueprint for Health, Agency of Human Services. Associate Professor of Healthcare Policy and Medicine, Harvard Medical School. CEO, Northern County Community Health. President-elect, American Academy of Pediatrics, Vermont Chapter. Chief Medical Officer, Blue Cross Blue Shield of Vermont. Madam Speaker, the success of primary care is when a patient actually changes their diet after they're being told they're pre-diabetic, whether they take their blood pressure medications consistently, whether they engage with their care team between visits, whether they have the support, tools, and follow-up necessary to sustain change over time and to have access when needed. A primary care fee-for-service payment system designed primarily around episodic in-office encounters is poorly equipped to address the ongoing needs of Vermonters. It is the intent of S197 to design a payment reform model for primary care in Vermont. Universal access to primary care will promote the public good by improving the patient's experience of care, improving population health, reducing costs, and improving the well-being of clinicians and staff. The vote in your House Healthcare Committee in support of S197 was 10-0-1, and we respectfully ask for the body's support.
And now speaking for the Committee on Ways and Means, member from Norwich.
Thank you, Madam Speaker. S-197 was referred to your House Ways and Means Committee because the report contemplated in Section 3A requires the recommendation of a process for moving to use of the health care claims tax as the mechanism to fund the blueprint. Your House Ways and Means Committee had a somewhat limited role here, but we found that S-197, as amended by the House Healthcare Committee, properly directs work related to the healthcare claims tax to the appropriate entities for conducting this work, the Agency of Human Services and the Commissioner of Taxes. In committee, we had the privilege of hearing from the chair of the House Committee on Healthcare, the Deputy Chief Counsel of the Office of Legislative Counsel, and the Principal Fiscal Analyst of the Joint Fiscal Office. Your House Ways and Means Committee found the bill favorable with a vote of 9-1-1, and we encourage the body to support it.
And now speaking for the Committee on Appropriations, the member from Morristown.
Thank you, Madam Speaker. Your Committee on Appropriations met and reviewed the bill. We took testimony from the reporter of the bill, the chair of your Healthcare Committee, staff from our Legislative Council, and our Joint Fiscal Office. We made the determination that there is no impact on the appropriations of the state of Vermont. The vote to recommend this favorably to you was 11-0-0. We ask for your support.
And now the member from Brattleboro, Representative Kornheiser, and the member from Woodstock, Representative Kimball, offer an amendment to the report of the Committee on Healthcare that was emailed to members at 2:25 p.m. Member from Woodstock.
Thank you, Madam Speaker. The member from Brattleboro and myself offer a technical amendment to the report. And it was really because during the presentation by Ledge Council and also with the Joint Fiscal Office, we noticed that there was one particular part of the report that was not aligned with the right division. It was with, just a minute, please. It was with the Agency of Human Services in consultation with the Green Mountain Care Board to really look at the financing available, or left that kind of open. What we are recommending is there are two different instances of amendment to correct that. The first is in Section 3 to adjust two different sentences. One is to, in Section 9, insert the word "and" instead of the semicolon. And then to put a period at the end of Section 10 and then eliminate Section 11 entirely and enter a new section, which is our second instance of amendment, that then asks for a report from the Agency of Human Services in consultation with the Department of Taxes to recommend in the House Committees on Healthcare and on Ways and Means and the Senate Committees, by which funding for the Blueprint for Health may be transitioned from the mechanisms to the healthcare claims tax as identified in the report the director of the Blueprint submitted to the General Assembly in accordance with Act 2023 Acts and Resolves number 51. So it's really to put in the appropriate hands. The recommendation is to looking towards a healthcare claims tax as a way to finance this different program, but in not putting that in the hands of Agency of Human Services or not with their responsibility and the Green Mountain Care Board. So it's really taxes. And we ask for your support.
Member from Rockingham.
May I have a moment to consult with the chair?
Would the member like to yield to the member from
I'll
Essex?
yield to the member from Essex, wherever.
The member from Rockingham yields to the member from Essex.
Yes, Madam Speaker, your Committee on Healthcare heard from Legislative Council and Joint Fiscal Office on the amendment proposed by the member from Brattleboro and Woodstock. And on a straw poll of 11-0-0, we found the amendment favorable, and we ask for everyone's support and to vote yes.
Member from Norwich.
I'm sorry, can I consult? Can I yield to the member from Woodstock?
The member from Norwich yields to the member from Woodstock for the straw poll.
Madam Speaker, our committee did not review the amendment in order to deliver a straw poll.
Okay. Will the House stand at ease for a moment? Okay. Will the House come to order, please? So the question is, shall the report of the Committee on Healthcare be amended as offered by the member from Brattleboro and the member from Woodstock? Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have amended the report of the Committee on Healthcare. Now the question is, shall the House propose to the Senate to amend the bill as recommended by the Committee on Healthcare as amended? Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have proposed to the Senate to amend the bill. Now the question is, shall the bill be read a third time? Are you ready for that question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and third reading is ordered. Member from Poultney, can you please offer us a motion to suspend rules to place Senate Bill 197 in all remaining stages of passage?
Madam Speaker, I make a motion to suspend rules in order to place S-197 in all remaining stages of passage.
The member from Poultney moves that we suspend our rules to place Senate Bill 197 in all remaining stages of passage. Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have placed Senate Bill 197 in all remaining stages of passage. Please listen to the third reading of the bill.
S-197, an act relating to payment reform for primary care.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? Member from Georgia.
Thanks, Madam Speaker. I know the reports are very complicated. They were difficult for us to comprehend, too, when it was presented in committee. I serve on the Ways and Means Committee, which has presented an amendment for the bill, but I voted for it. And Madam Speaker, I hope that members in the chamber will also see their way to vote yes on this. We haven't been able to come up with very many plans that will actually reduce healthcare costs, but this is one. And so although it's complicated, I want members to feel free to talk with anybody from Ways and Means, and especially the presenting committee, Healthcare, and hopefully we can get this passed and improve healthcare situations a little bit for our people here in Vermont. We hear about healthcare costs all the time, and especially as we continue to work on school costs. And I could go on and on about this topic, but I intend to vote yes, Madam Speaker. Thank you.
The question is, shall the bill pass in concurrence with proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have passed the bill in concurrence with proposal of amendment. Member from Poultney, can you please offer us a motion to suspend our rules to message our action on Senate Bill 197 to the Senate forthwith?
Madam Speaker, I make a motion to suspend rules in order to message our actions on S-197 to the Senate forthwith.
The member from Poultney moves that we suspend our rules to message our action on Senate Bill 197 to the Senate forthwith. Are you ready for the question? If so, all those in favor, please say aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended our rules to message our action on Senate Bill 197 to the Senate forthwith. Member from Poultney, on our notice calendar is the Senate proposal of amendment on House Bill 578, which is an act relating to penalties and procedures for animal cruelty offenses. Can you please offer us a motion to suspend our rules to take up House Bill 578 off the notice calendar for immediate consideration?
Madam Speaker, I make a motion to suspend rules in order to take up off the notice calendar for immediate consideration H 578.
The member from Poultney moves that we suspend our rules to take up House Bill 578 off the notice calendar for immediate consideration. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up House Bill 578 for immediate consideration. House Bill 578 is an act relating to penalties and procedures for animal cruelty offenses. The bill passed the Senate in concurrence with a proposal of amendment that is printed in today's calendar. Member from Burlington.
Thank you, Madam Speaker. It's been a while since we've talked about animal cruelty, and I won't be going into detail. What I'd like to share is today, when we heard from our Ledge Council and then the Director of Animal Welfare, the Director of Animal Welfare characterized the House bill as a very strong bill that went to the Senate. And her characterization was that the Senate did a good job of refining points that were ambiguous or questions that came up afterward during testimony. So the changes in this amendment from the Senate fall into really two categories. Some of them are housekeeping and putting consistency in place, and some are more policy changes. So I'm going to walk you through the amendment and speak about those. So the first change is in Section 2, which is 13 VSA 352 section. So that change is a technical one, and it's correcting basically the reference, the cross-reference in there. The second change in that subsection is a little bit more of a policy change, which is to add that the periodic unannounced visits can be made not only by a humane officer, which is how the House sent the bill over, but it added in the Director of Animal Welfare. The next change is a procedural change. And again, this is working to make sure that the bill is consistent in several sections, because what we heard is if we're not consistent in these sections that are related to what we're requiring, the courts might be under the impression that we purposely weren't consistent, and it may end up jeopardizing the ability for the charges to stick or for the evidence to be admissible. So the first of those changes adds the words we sent it over with the Secretary of Agriculture, Food and Market shall be consulted. The Senate added in, if practicable, after shall. And you'll hear that that occurred in many other cases. Also in that same section, the Senate added in words or exclusion of evidence after the House's sentence of failure to conduct the consultation shall not be grounds for dismissal of the enforcement action. And now it reads, or exclusion of evidence. In the next subsection, parentheses 1, voluntary surrender. Again, the Senate has added in, or as soon as reasonably practical, after the humane officer shall have surrendered animal examined and assessed within 72 hours. Also at the end of that sentence of by a veterinarian licensed to practice in the state of Vermont. The Senate added in failure to have the animal examined and assessed within 72 hours or as soon as reasonably practicable shall not be grounds for dismissal of the enforcement action or exclusion of evidence. Then again, in small parentheses 2, at the end of the sentence, failure to be accompanied by a veterinarian during the execution of the search warrant shall not be grounds for dismissal of the enforcement action, and the Senate added in or exclusion of evidence. So those changes all will tighten up the ability of the charges to not be thrown out or the evidence not to be thrown out. The next sort of cleanup is the House bill interchangeably used the word custodial caregiver or custodial caretaker. The Senate changed all the caregivers to caretaker. Again, we're talking about the custodial caretaker who's taking care of the animal if it has been seized. Another sort of housekeeping kind of change to make it cleaner and clearer is the Senate changed where the House had, unless a person claiming a legal interest, to unless a person claiming an ownership interest, to make clear to everyone that the law is really looking at what the owner is legally allowed to do and not just a vague legal. That change is made twice, once in subsection 1 and one in subsection 2. And then we move into more of a policy substantial change. So what we heard is that the Senate really wanted to beef up the notice requirements further. So starting at the bottom of subsection 2, in addition to a humane officer seizing an animal if a person is present and giving notice because they're there, the Senate added in, the officer shall also give notice of the section by conspicuously posting a copy of it at the time of the seizure in a prominent and accessible place at the location of where the animal is seized. For any person who is known to claim an ownership interest in the animal and who is not present at the time of the seizure, the humane officer shall make reasonable efforts within 96 hours following the seizure to give notice of the section by personal service or registered mail addressed to the last known address of the person. So again, that's really important. The Senate, again, was trying to balance making sure we are swiftly dealing with animals who are suffering and in pain, but also really giving ownership notice for due process to any of the rightful owners. Again, then we have a few cleanup parts where we go from a legal interest to an ownership interest. Another policy change that the Senate made after taking testimony was moving the forfeiture hearings from civil court, where the House had it, into criminal court. And they had several reasons for doing that. They talked to state attorneys who are much more familiar with forfeiture hearings happening in criminal court. In fact, 12 of the 14 state attorneys strongly preferred that we have these forfeiture hearings held in criminal court. Since they're familiar with those proceedings, it will not be slower, which was one of the worries that the House had, to have these proceedings happen in the criminal court. And it is where a lot of other forfeiture hearings happen. Then we move back into some more, there's another policy change, which is basically the Senate wanted to make sure that the Director of Animal Welfare shall make payment not to exceed the security received to the custodial caretaker upon receipt of proof of expenditures. So basically, there are two ways that people are paying. They put down a deposit or make an initial payment when their animal is seized. And then it's trued up depending on what the outcome is of the hearing and what the actual costs were. And again, this fund is basically paid by the security money and the actual receipts that are collected by the Director of Animal Welfare. And so given that there are very few other ways that this fund currently gets money, it was important to kind of have some parameters on what the ability is to pay back expenses. They also added in more language to make sure that it's clear in every sort of place that made sense, to add in that the findings shall include the total amount of costs incurred by the custodial caretaker and the amount the person claiming an interest in the animal is able to pay. And you might remember that we wanted to make sure that people weren't losing their animals strictly because they weren't able to pay the money. And so there is a procedure the House put in place that the courts can determine what the owner is able to pay. So the other parts of the bill that got changed by the amendment are clearing up that we're not trying to double charge people for the care and cost. So whatever they paid in their security deposit is deducted from the actual costs. So there's no worry that people are paying more than they should be paying. The Senate also added that the title to the animal shall be forfeited if the owner does not make the payment unless a financial hardship reduction or waiver request is pending or has been granted. And again, the worry is that there'll be no incentive for people to pay unless there's some consequence for that. So we have a few more housekeeping things of clearing up caretaker. Then the Senate, again, added in the next section, which is the appellant shall post security, that again, failure to timely pay the full amount shall result in forfeiture to title to the animal unless a financial hardship reduction or waiver request is pending or has been granted. The Senate struck out the amount of the security and payment schedule shall be set in rules. And what we learned is that the Senate is moving away from having rulemaking set set fees, and wants that done in statute. So language related to the Director of Welfare getting ready to do rulemaking is also taken out. There was an established temporary rate put in place until such rates are set up by the legislature. So basically, Section 8 sets up that before December 1st, 2026, the Director of Animal Welfare shall report to the House Committees on Judiciary and Ways and Means and the Senate Committees on Finance and Judiciary on the proposed amount of the security and the proposed payment schedule, including proposed statutory language. Until legislation establishing the amount of the security and the payment schedule takes effect, the amount of security under 13 VSA 354D and G shall be required pursuant to this section. So these are the temporary rates that are set up, and they're very low, and they're purposefully low because they're really, one, just a deposit. And the idea wasn't to make people pay more than the actual costs were going to end up being. So if it's a domestic animal like a cat, a pet, a dog, a gerbil, a guinea pig, the security is $1 per animal per day for food. And if the seizing officer determines that immediate veterinary care is required to protect the animal's health or safety, $250 per animal for veterinary services. If it's a livestock animal, the security temporary amount is $2.50 per animal per day for food. And if the seizing officer determines that immediate veterinary care is required to protect the animal's health or safety, it's a $500 per animal deposit for veterinary services. So our committee took a straw poll and recommended that we concur on a vote of 11-0-0, and we ask for the body's support.
And now member from Thetford.
Thank you, Madam Speaker. Ways and Means reviewed the amendment, the report back from the Senate, and we haven't seen the bill for quite some time, Madam Speaker. And so I'm very grateful for the previous member's explanation of all the changes in the bill. Very thorough, very tightening up, as the member said, on the legislation, the wording therein. But we spoke to Ledge Council and also to JFO, and at the end of the day, Madam Speaker, we determined that determined is maybe the wrong word. The impact on revenues of the state was indeterminable, but not of any great impact. And so on a straw poll, I believe all members were present, 11-0-0. We recommended that the bill ought to pass as recommended just now. Thank you, Madam Speaker.
So the question is, shall the House concur in the Senate proposal of amendment? Are you ready for the question? Member from South Burlington.
Madam Speaker, we must be a voice for the animals. They cannot advocate for themselves. As a society, we are their voice, and it is our responsibility to protect those who are vulnerable and unable to defend themselves. H578 is important because it addresses both the immediate suffering of animals and the need for lasting change. I want to thank all the committees that worked on this bill, and I'm very grateful, and I encourage the body to support H578. Thank you.
The question is, shall the House concur in the Senate proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have concurred in the Senate proposal of amendment. Member from Poultney, on our notice calendar is the Senate proposal of amendment on House Bill 727, which is an act relating to sustainable data center deployment. Can you please offer us a motion to suspend rules to take up House Bill 727 off the notice calendar for immediate consideration?
Madam Speaker, I make a motion to suspend rules in order to take up off the notice calendar for immediate consideration H727.
The member from Poultney moves that we suspend our rules to take up House Bill 727 off the notice calendar for immediate consideration. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and you have suspended rules to take up House Bill 727 for immediate consideration. House Bill 727 is an act relating to sustainable data center deployment. The bill passed the Senate in concurrence with a proposal of amendment that is printed in today's calendar. Member from Dover.
Madam Speaker, the House passed H727 on March 31st. And in that version, we established a regulatory framework for large data centers, 20 megawatts or larger, in Vermont, focused primarily on PUC oversight, protecting existing ratepayers from subsidizing large new electric loads, and ensuring projects were reviewed through Vermont's existing energy and permitting structures. The Senate proposal keeps that overall framework, but makes a number of changes and expansions related to ratepayer protections, demand-side management, water use, PFAS oversight, and reporting requirements, and long-term regulatory oversight. The Senate version, as well as a side-by-side comparison, can be found on the House Energy and Digital Infrastructure Committee page on Thursday, May 14th. Changes that the Senate made. In Section 1, they expanded the purpose section by adding language stating that the regulatory framework should financially benefit existing ratepayers. The Senate also added a definition for electric company and expanded the definition of facility to include multiple non-adjacent sites operating as a single integrated operation under centralized management. The Senate also expanded language under the large load service equity contracts. These are the required contracts between a 20 megawatt or larger data center and the electric utility that serves it. The Senate added new requirements to the contract approval process, including that it be a minimum of 10 years duration, that there would be mandatory compliance with the new demand side management provisions. They added in load curtailment procedures and priorities, required written PUC findings with the rationale, a mandatory PUC review every 2 years, and authority for the PUC to reopen reviews for good cause or public interest concerns. There was significant expansion on the demand side management requirements. The House bill focused primarily on energy efficiency design in advance. The Senate expanded this section by adding a site suitability analysis, broader project design standards, restrictions on combustion-based backup generation with a late-breaking third reading amendment that accepts that for energy that is heating the facility. It requires distributed renewable generation on the plant as much as possible, energy transformation payment requirement, virtual power plant participation provisions. This is the place that the Senate did the most expansion. It also expanded the reporting requirements, adding a requirement that quarterly reports be public, and narrowed the focus for annual DPS reports, emphasizing regional developments. Section 2, it expanded the Act 250 applicability, adding language requiring Act 250 review even when a data center is located within a Tier 1A area. And Section 3, which has to do with water and cooling and PFAS, the cooling system standards were modified. The House version generally required a closed-loop cooling system unless it was infeasible. The Senate instead allows closed-loop cooling or an alternative approved by a district commission that uses no more water than a comparable closed-loop system, minimizes groundwater and surface water use, and does not unreasonably burden water resources. A water quality certification, Section 401 style, that was included in the House version was removed by the Senate, and instead they have required that the Agency of Natural Resources assess if a project uses more than 150,000 gallons a day of surface water, creates a rebuttable presumption against undue water pollution after A&R review, and allows A&R to reduce the threshold by rule. The PFAS requirements section in the House, we required identification of the PFAS, the submission of a monitoring plan, and a prohibition on adding PFAS to discharged water. The Senate replaced that with mandatory monitoring for the maximum number of PFAS detectable under EPA-approved methods, a prohibition on exceeding Vermont water quality standards, which I will note do not exist yet. They are in process. Monitoring of withdrawn water if no PFAS standards exist, and a requirement that discharge PFAS levels not exceed levels present in the withdrawn source water. In section 3A, we have added a new A&R PFAS report, which will be due January 1st, 2027, recommending standards for PFAS discharges from data centers. In section 4, we have expanded slightly the renewable energy market study to ensure that the House Environment Committee is also a recipient of the PUC Market Conditions Report. In Section 5, the Senate added a requirement for a clear delineation of regulatory authority if multiple entities are overseeing approval of decommissioning, and also compliance with the Federal Storage Device Sanitation and Destruction Manual. In Section 6, the Senate moved the application, and this remains largely unchanged with an effective date on passage. Some of the permits that are included in this bill are not yet available. As I noted, the House Energy and Digital Infrastructure Committee reviewed the changes with Legislative Counsel and conducted a straw poll and voted 8-1 to concur with the Senate version of H727. We believe that this is an area of policy that we will be coming back to. We are aware of the governor's executive order looking at AI, and we believe that this policy provides a pretty strong framework, both protecting ratepayers and our water, and is in line with our land use policies. And with that, we are looking for your support.
The question is, shall the House concur in the Senate proposal of amendment? Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. Nay. The ayes appear to have it. The ayes do have it, and you have concurred in the Senate proposal of amendment. Members, that completes the orders of the day. Are there any announcements? Member from Brattleboro.
Madam Speaker, I have a special guest here today, my mom. She is in Montpelier today attending a youth justice summit. She was attending in her role as a guardian ad litem. Guardian ad litems play a critical role here in Vermont in our justice system, and I am so proud of the work that she does, and I'm grateful that she does it. Further, I wouldn't be here in this seat today without her love and support, and for that I am even more grateful. She's seated up in the balcony. Can you please join me in welcoming her to the People's House?
Will the family of the member from Brattleboro please rise and be recognized? Are there any further announcements? Seeing none. Member from Poultney, can you please offer us a motion to adjourn until Thursday, May 21st at 10 a.m.?
Madam Speaker, I make a motion this body stand in adjournment until Thursday, May 21, 2026 at 10 a.m.
You have heard the motion. Are you ready for the question? If so, all those in favor, please say aye. Aye. All those opposed, please say nay. The ayes appear to have it. The ayes do have it, and this body stands in adjournment until tomorrow at 10 a.m.